Why do some wounds never heal? If you've ever wondered why a wound lingers for weeks or even months, despite doing all the right things, you're not alone. This is one of the most common frustrations in wound care. Most people think wounds don't heal because they're dirty or infected, but that's surface level assumptions. The truth is much deeper and often much less obvious, which is why if you know these 5 hidden reasons your wounds never heal, you can finally start taking the correct approach in helping your wounds heal. So in this video, I'm going to break down what they are and what you can do about each of them. For those who don't know me, my name is Dr. Cassandra Voltaire. I'm a family medicine physician and a wound care provider. I've been taking care of people with wounds for years, in clinics, nursing homes, hospitals, you name it. The first hidden reasons wounds don't heal is poor blood flow. This one sounds obvious, but you'd be amazed at how often it gets overlooked. A wound can't heal if it's not getting oxygen and nutrients. You can use the fanciest dressing in the whole world, but if the supply lines are blocked, nothing's going to grow. I once had a patient with a wound on her foot. Everyone was treating it like an infection. She was on antibiotics, she had daily dressing changes, but it wasn't improving. When I checked her pulses, they were faint. We ordered an arterial study, and sure enough, she had severe peripheral arterial disease. After revascularization, that wound finally started to heal. It was never about the infection, it was about flow. So here's the lesson. Always check inflow. Feel for pulses, order ABIs if you can. Don't assume, because if you don't restore blood flow, nothing else matters. The second hidden reason is swelling. Edema is one of the most underestimated barriers to healing. People think of swelling as an annoyance, but it's actually a huge problem. When fluid builds up in the tissues, it slows circulation, weakens the skin, and literally drowns the cells that are trying to repair. I tell my patients it's like trying to build a house in a swamp. You can use the best materials, but if the ground is soggy, nothing sticks. Compression, elevation, and lymphatic massage. These aren't extras, they're essential. And yet, I see so many wounds stall because swelling was never addressed. Learning more about this together is actually one of the reasons I built the Wound Care Circle, because so much of wound care is about connection, learning from each other, sharing what works, and not feeling like you're managing these wounds all by yourself. Inside the community, we talk through real cases just like this one. You get to hear how other providers are handling the same challenges, and you realize you're not alone in this. You can access the link below. On to number 3. The third hidden reason is infection, or more accurately, bioburden. Now let me be clear. Not every wound that looks red or weepy is infected in the way people think, but wounds can get stuck in this gray zone where bacteria are present at higher levels than the body can handle, even if there's no obvious infection or fever. This is where biofilm comes into play. Biofilm is like a shield bacteria build. It makes them harder to kill and keeps wounds inflamed. If you don't break through that biofilm, you can be stuck in a cycle of stalled healing. The fix is regular debridement, good cleansing, sometimes topical antimicrobials. It's not always about systemic antibiotics. It's about controlling the bacterial load so the body can actually repair. The fourth hidden reason is nutrition. I can't tell you how many times I've seen this missed. Wounds are builders. They need raw materials, protein, vitamins, calories. If a person doesn't have these resources, the wound is asking for bricks and mortar that the body just doesn't have in stock. I had a frail man in a nursing home with a sacral ulcer. We were trying everything, dressings, repositioning, pressure relief, but the wound wasn't budging. Then we looked at his diet. He wasn't eating enough protein and he was losing weight. We added supplements, worked with a dietitian, and suddenly the wound started closing. Sometimes the problem isn't in the dressing aisle, it's in the kitchen. And the fifth hidden reason wounds don't heal is pressure. This might sound like it only applies to pressure ulcers, but it's bigger than that. Pressure means any mechanical force that keeps blood from flowing freely. It might be a heel resting on a mattress. It might be a poorly fitted shoe pressing on a diabetic foot ulcer. It might be a sitting position that keeps a sacral wound under constant stress. I'll never forget a patient with a heel ulcer. Everyone was cleaning it, dressing it, charting it, but it wasn't healing. When I lifted his leg, I realized his heel had been resting on the bed frame for weeks. No amount of dressing was going to fix that. We put him in an offloading boot, and the wound finally started to close. Pressure is physics, not just biology, and if you don't fix it, nothing else works. So those are the 5 hidden reasons wounds don't heal: poor blood flow, swelling, infection and bioburden, poor nutrition, and pressure. Now here's the thing. Most wounds that stall don't just have one of these issues. They have 2, 3, sometimes all 5. And that's what makes them so tough. You can't just throw a dressing at them. You have to take a step back, look at the bigger picture, and ask what's missing. If you're new to wound care, the takeaway is simple. Don't just stare at the wound bed. Look upstream. Ask about flow, swelling, nutrition, and pressure. If you're more advanced, I'd challenge you to think about the interplay. How does swelling affect blood flow? How does pressure complicate infection control? The answers are rarely siloed. And if you're a caregiver, here's the one thing you can do right now. Reposition, moisturize, and make sure your loved one is eating well. That alone can change the trajectory. The hardest wounds to treat are the ones that ask you to juggle competing truths. You can't push too hard in one direction without causing harm in another. And that takes patience, humility, and sometimes the courage to say, we need a team. And now that you know more why your wounds won't heal, if you knew how to clean these wounds the right way, it allows them to heal much faster. And there's actually something that I've started doing recently that's helped me speed up the time it takes for wounds to heal significantly. So watch this next video where I show you what it is, how you can use it, and how you can harness it to treat your patients faster. Stay informed and heal well.